Week 1 of 52. What is endometriosis? The Complete Beginner's Guide disclaimer. Read this aloud at the start. This video is for educational purposes only and is not medical advice. Always consult a qualified healthcare provider for your personal health needs. Did you know that endometriosis affects roughly 1 in 10 women and people with a uterus worldwide? Yet most people have never even heard of it? If you've been suffering through painful periods, chronic pelvic pain, or exhaustion that no one seems to take seriously, this channel is for you. Over the next 52 weeks, we're going to break down everything you need to know about endometriosis in plain, honest, compassionate language. Let's start from the very beginning. Welcome. I'm so glad you're here. Today, we're covering the foundation. What exactly is endometriosis? Where does it come from? Who gets it? And why does it take so long to diagnose? By the end of this video, you'll have a clear, complete picture of this condition, and you'll finally have the words to describe what you or someone you love might be going through. Endometriosis, pronounced endometriosis, is a chronic condition where tissue similar to the lining of the uterus grows outside the uterus. Now, let's break that down. Every month, the lining of your uterus, called the endometrium, thickens, preparing for a potential pregnancy. If pregnancy doesn't happen, that lining sheds. That's your period. With endometriosis, similar tissue grows in places it doesn't belong. This can include the ovaries, the fallopian tubes, the outer surface of the uterus, the bowel and bladder, and in rare cases, even further away, like the lungs or diaphragm. Here's the problem. This tissue still responds to your hormonal cycle. It still thickens and tries to shed, but it has nowhere to go. The result? Inflammation, scarring, lesions, and often severe pain. Unlike your period blood, which exits the body, this misplaced tissue becomes trapped. Over time, it can cause organs to stick together, a process called adhesions. This is why endometriosis is so much more than bad periods. It's a full-body, chronic, inflammatory disease. What causes it? Here's something many people don't know. Scientists still don't fully understand what causes endometriosis. But there are several leading theories. Theory 1, retrograde menstruation. This is the most widely discussed theory. It suggests that during menstruation, some blood flows backward through the fallopian tubes and into the pelvic cavity, depositing endometrial cells outside the uterus. However, this happens in most people who menstruate. So why do only some develop endometriosis? That's where other factors come in. Theory 2. Immune system dysfunction. Some researchers believe that in people with endometriosis, the immune system fails to recognize and destroy the misplaced tissue. Instead of attacking it, the body allows it to grow and thrive. Theory 3. Genetics. Endometriosis tends to run in families. If your mother, sister, or aunt has it, your risk is significantly higher. Research continues to explore which genes may be involved. Theory 4. Environmental factors. Some studies suggest that exposure to certain chemicals, like dioxins, may play a role in triggering or worsening the condition. The honest answer is it's probably a combination of factors. And the fact that research has been underfunded for decades has slowed our understanding. More on that in a future video. Who gets endometriosis? Endometriosis can affect anyone who menstruates, regardless of age, race, or background. Some key facts. It's estimated to affect over 190 million people worldwide. It most commonly affects people in their 20s, 30s, and 40s, but it can also begin in teenagers, and symptoms often start with the very first period. It is not contagious. It is not caused by anything you did wrong. It affects people across all racial and ethnic backgrounds, though research shows that Black and brown individuals are often diagnosed even later than average one painful truth. The average time from first symptom to diagnosis is 7 to 10 years. That's not because the condition is rare. It's because for too long, painful periods have been dismissed as normal. They are not normal. Pain that disrupts your life, your work, your relationships, that is never just normal. Common symptoms. Endometriosis symptoms vary widely from person to person. Some people have severe pain, others have almost none, yet still have significant disease. The most commonly reported symptoms include pain, painful periods, often described as debilitating, not just uncomfortable, chronic pelvic pain, even between periods, pain during or after sex, pain with bowel movements or urination, especially during your period, lower back and abdominal pain, other symptoms, bloating, often called endobelly, where the abdomen swells significantly, extreme fatigue and exhaustion, heavy or irregular periods, difficulty getting pregnant. Endometriosis is found in 30 to 50% of people struggling with infertility, nausea, especially around menstruation. One important note: the severity of symptoms does not always match the severity of the disease. Someone with minimal visible lesions may be in agony, while someone with widespread endometriosis may feel very little. This is one of the reasons diagnosis is so difficult, and why it's so important to listen to patients, not just lab results. Outro and call to action. So let's recap what we covered today. Endometriosis is a chronic condition where tissue similar to the uterine lining grows outside the uterus. It causes inflammation, scarring, and pain, and affects the whole body. The exact cause isn't fully known, but genetics, immune function, and hormones all play a role. It affects roughly 1 in 10 people who menstruate. Symptoms vary widely, but pain that disrupts your life is never just normal. This is just the beginning. In next week's video, we'll cover the symptoms that doctors most commonly miss and how to advocate for yourself when you feel like no one is listening. If this video helped you, please share it with someone who needs it. Hit subscribe so you don't miss a single week, and in the comments, I'd love to know, how long did it take you to get your diagnosis? Let's build this community together. Take care of yourself. You deserve answers.